According to the CDC in 2014, every 40 seconds, someone in the United States has a stroke. It is the fifth leading cause of death in the United States, killing more than 130,000 Americans each year. So, what is a stroke? A stroke is known as a cerebrovascular accident, or CVA, and is commonly called a brain attack. Similar to a heart attack, this is a medical emergency. It is characterized as a neurological deficit due to an injury to the central nervous system by a vascular cause. Strokes are commonly categorized by etiology as hemorrhagic or ischemic strokes. A hemorrhagic stroke is a spontaneous bleed in the brain that decreases perfusion. Common symptoms include the worst headache ever or loss of consciousness. An ischemic stroke is a blockage of blood flow to an area or areas of the brain. The area of the brain that is cut off from the blood supply loses some or all of its function, depending on how long the clot is present.
A transient ischemic attack, or TIA, is caused by a blood clot. The only difference between a stroke and a TIA is that the blockage is transient or temporary. These symptoms act as a warning sign by mimicking a stroke but often last 1 to 5 minutes. These usually cause no permanent damage to the brain. Having a TIA can increase the risk that you will have a stroke later in life. If you think you are experiencing a transient ischemic attack, it is very important that you treat it as a medical emergency and seek immediate medical attention. Common stroke symptoms include sudden trouble seeing in one or both eyes, sudden confusion, trouble speaking or understanding, sudden trouble walking, dizziness, loss of balance or coordination, sudden severe headache with no known cause, or sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. If you notice any of these stroke symptoms, note the time they begin and seek immediate medical attention. Time lost is brain lost. Some risk factors for stroke are non-modifiable, meaning these cannot be changed or affected. However, there are some risk factors for stroke that are modifiable and you can do something about them. These factors include hypertension or high blood pressure, tobacco smoking, and atherosclerosis. About half of Americans have at least one of these 3 risk factors. So now let's talk about ways to prevent a stroke. According to the U.S. Department of Health and Human Services, hypertension is the main risk factor for stroke. Your blood pressure is considered too high if it stays at or above 140/90 for an extended period of time. However, what may be a good blood pressure for you personally depends on other health conditions. The good news is that hypertension is modifiable with some lifestyle changes. Some of these changes are to decrease sodium intake, decrease alcohol consumption, lose a modest amount of weight, increase physical activity, and last but not least, consult with your provider regarding other ways to reduce your blood pressure. Smoking is a major contributor to hypertension and stroke. Smoking can damage your blood vessels, causing your blood pressure to rise, and can reduce the amount of oxygen that reaches your body's tissues. Studies have even found that exposure to secondhand smoke can increase your risk of stroke. Data from the Framingham Heart Study demonstrated that stroke risk decreases after 2 years from when smoking cessation begins, and returns to the level of non-smokers by 5 years. Atherosclerosis is a disease in which plaque builds up inside your arteries. Plaque is made up of cholesterol, fat, calcium, and other substances found in the blood. These plaques stick to the artery walls and make it difficult for blood to pass through to various places of the body, including the brain. When plaque causes a decrease in blood flow to the brain, a stroke can occur. By controlling your diet and eating less cholesterol and fatty foods, you can help prevent atherosclerosis. Now, let's review. By focusing on lifestyle changes such as hypertension management, smoking cessation, and management of atherosclerosis, you can reduce your risk of stroke. And remember, time lost is brain lost. For more information, visit the resources offered by the associations listed below.
Created using Powtoon.